You are viewing Part 2 of Infection Control. This in-service is required for all clinical employees upon hire and annually thereafter. You will need the handouts titled Sequence for Donning Personal Protective Equipment, or PPE, and the handout Sequence for Removing PPE, as well as the post-test. To successfully complete this training, you must view the entire video and successfully complete the post-test. This in-service is designed for clinical staff who perform direct patient care. You must have completed the first infection control in-service in order to participate in this in-service. During this in-service, you will learn required skills to prevent the spread of infection. Each of the skills learned here should be considered mandatory. The first skill that we will learn is bag technique. The purpose of bag technique is to reduce the risk of cross-infection between patients via the visit bag and the supplies that it contains. The visit bag needs to be kept clean. Clean the bag when it is visibly soiled. Periodically wash or wipe the bag with a disinfectant inside and out. Keep the bag in a clean area of your car that is free from food, dirt, and other items that could promote bacterial growth. Place the bag in a clean area of a home. Appropriate areas include placing the bag on a clean hard surface or on a paper towel or trash bag, or hanging the bag on the back of a door or a doorknob or a chair. Avoid contaminating the patient's home with your bag. Do not place it on the patient's bed or place roller bags with wheels on the patient's furniture. Keep the bag away from bugs, pets, and places where there is a high bacterial burden, such as floors or dirty furniture. Keep the bag in the car when homes are infested or if the patient is on contact precautions. Consider bringing items in a fanny pack or a small plastic bag. Visit bags have dirty areas and clean areas. Dirty areas of the bag include the outside of the bag and the place where you keep your hand hygiene items, which is typically a pocket or a compartment of the bag. Clean areas include an inside closable area to keep patient care items, such as your stethoscope, pulse oximeter, goniometer, also single-use items, and PPE. Bag technique requires keeping the inside of the bag and all of its contents clean. Only enter the clean part of the bag with clean hands. Perform hand hygiene immediately prior to entering or re-entering the bag. Keep items used on multiple patients clean by placing them on a clean surface when removing them from the bag. A paper towel could be used for this purpose. You will also need to disinfect parts that have touched the patient before putting them back into the bag. This is done using alcohol or disinfectant wipes. When choosing a work surface for supplies removed from the bag, consider that finding a clean area, an area with adequate lighting that is away from traffic, pets, and children, and that is away from heat or cooling vents. When using electronic devices, such as tablets or phones, apply the following principles of bag technique. Cleanse hands between patient care and touching the keyboard or device. Keep the device in a separate bag or a separate compartment of your bag where it does not contaminate patient care supplies. Wipe down the device and keyboard with a disinfectant wipe at least once per day and more often if it gets contaminated. Let's put this all together. Upon entering the patient's home, place the bag in a clean place. Perform hand hygiene. Open the clean part of the bag and remove needed items from the bag. Place the items on a clean surface or on a barrier such as a paper towel. Close the bag. Provide patient care, remembering that if you need to re-enter the bag, you need to clean your hands, get the item, and close the bag. Clean and disinfect reusable items before returning them to the bag and allow them to dry. Wipe your stethoscope, blood pressure cuff, etc. with an alcohol wipe or a disinfectant wipe. Then return the items to the bag and perform hand hygiene after all care, all documentation, and just before leaving the home. Pathogens exist on the surface of items that are used on one patient to another. Many of these pathogens can exist for long periods of time, hours, days, even years. Most healthcare-associated infections and multi-drug resistant organisms are transmitted by hands and equipment. Transmission of infections from one infected person to a new susceptible host can be prevented by adequately cleaning and disinfecting. First, let's look at some definitions. Cleaning is the removal of adherent visible soil, blood, proteins, and other debris from surfaces by a mechanical or manual process. Generally accomplished with soap and water, cleaning removes the reservoirs of pathogenic organisms. Sanitizing is often used in food service. It uses a low-level active ingredient to reduce bacteria to a safe level. Wash, rinse, sanitize, and air dry. Disinfecting kills many or most organisms. It uses an active ingredient and consists of levels, which we will discuss later on. And finally, sterilizing. Sterilizing destroys all organic and inorganic microorganisms, including spores. It requires heat or extended contact with strong chemicals. Using the Spalding system, equipment and devices used in healthcare have been divided into 3 categories, each requiring a different level of disinfection. The 3 categories are critical. These are items that enter patient tissues or a sterile body cavity. Some examples would be needles, catheters, or other items. The procedure for this level of disinfection is sterilization. In home care, these are usually single-use, disposable items. The second level of disinfection is semi-critical. These are items that touch mucous membranes, blood, secretions, or non-intact skin. Some examples would be thermometers or scissors that are used on a dressing change. The procedure for semi-critical items is high-level disinfection. High-level disinfection is done with one of the following: a 110 bleach solution, 70% alcohol solutions or alcohol wipes, EPA-approved disinfectants labeled as tuberculocidal, such as Lysol. Non-critical disinfection refers to items that touch intact skin, such as blood pressure cuffs or stethoscopes. The procedure for non-critical items is low-level disinfection. Low-level disinfection is done using the following: a 150 to a 100 bleach solution, a 70% alcohol solution such as alcohol wipes, or EPA-approved disinfectants such as Clorox wipes or Lysol. Ensure that the equipment and devices are clean before being disinfected. Remove any debris left on the item. Debris left on the item can create a reservoir for pathogens, rendering disinfection ineffective. Only adequately cleaned and disinfected supplies can be placed back into a supply bag. Almost all reusable supplies can be disinfected using alcohol wipes or tuberculocidal disinfectant wipes. Always use appropriate PPE when disinfecting equipment, and follow the manufacturer directions for the disinfectant that you are using by checking the label or MSDS sheet. If you cannot adequately clean an item, it should be placed in a plastic bag labeled dirty and returned to your supervisor. When cleaning electrical equipment or battery-operated items, follow manufacturer directions. Always unplug the item. Do not allow liquids to enter the electrical components. Next, we will talk about clean and sterile technique. Clean technique is a generally acceptable practice for many home care procedures. It refers to reducing the overall number of microorganisms present or to preventing or reducing the transmission of microorganisms from one person to another or from one place to another. It involves hand hygiene, using barriers and sterile materials and supplies, maintaining a clean environment, and preparing a clean field to prevent the contamination of supplies. Sterile technique refers to rendering and maintaining objects and areas free from microorganisms. This involves thorough hand hygiene, the use of sterile barriers, as well as the use of sterile instruments and supplies. In the home, a sterile field should be established to prevent the transmission of microorganisms from the environment or from the clinician to the patient. It involves using a sterile barrier and, at minimum, wearing sterile gloves. The inside of the sterile package can be used as a sterile surface if it has not touched a non-sterile item. If possible, turn off ceiling fans and close doors to reduce the potential for airborne transmission of microorganisms. In the home setting, maintaining a clean environment is not always within direct control of the agency. However, the immediate environment should be kept as clean as possible. Remember, once sterile solutions are opened, they must be dated and discarded at established intervals. So let's put it all together. Perform hand hygiene. Inspect all packaging. If it is damaged, wet, or stained, do not use the items. Verify the expiration date has not expired. Inspect all bottles or solutions for signs of contamination. This includes chips, tears, cracks, cloudiness, discoloration, or solid items floating inside, no matter how small. When opening the item, take extreme care to assure the inside does not touch anything on the outside. Do not touch any sterile item with your hands. Always wear sterile gloves before touching sterile items. Always place sterile items exclusively on a sterile surface. This may include a separate sterile tray or a sterile cloth or paper barrier. Perform sterile or clean procedure. Dispose of soiled supplies in appropriate containers. And when you're finished, make sure to perform hand hygiene. Spills of blood or body fluid on any surface should be cleaned immediately. Broken glassware may be contaminated and must be picked up using mechanical means such as a broom and dustpan or tongs or forceps. Do not pick up or touch broken or contaminated glass even with a gloved hand. When we discuss the blood spill procedure, we want to remember that it is not referring to only blood, but also to other body fluids. The procedure is as follows. Adhere to standard precautions, including gloves and aprons or gowns if necessary. Place paper towels over the spill area and allow the spilled material time to absorb into the paper towels. If broken glass is involved, find a rigid, impermeable container to put the glass into before putting it into the trash. Some examples of a rigid container would be extra sharps container, a Clorox bottle, a coffee container if it is metal or hard plastic. Use a broom or a brush to sweep broken glass and towels into the dustpan. Place the rigid, impermeable container into a plastic bag and secure shut. Discard in the regular household trash. Make sure to disinfect the reusable dustpan and broom after use. If no broken glass is involved, place towels or absorbent cloth containing spill material in a plastic bag. Secure the bag closed. If the household trash has a plastic liner, discard it into the trash. If the household trash is lined with paper or is not lined, place the bag in another plastic bag and secure it. Clean and disinfect the area contaminated with blood or body fluids. You will do this using a detergent. Once clean, you will disinfect with alcohol, bleach, or a disinfectant solution using paper towels or an absorbent cloth. Keep the surface damp with disinfectant for the length of time specified by the manufacturer and air dry. Remove and discard disposable gloves and perform hand hygiene. Remember that disinfectants can be damaging to carpet, fabric, and other surfaces. They should be used in residences only with the homeowner's permission. You will need to document that the homeowner has given you permission. If the homeowner refuses to allow you to use a disinfectant, clean up the spill the best you can using the paper towels. Educate the homeowner about the risks associated with infection transmission and document all of the above. And whether there's broken or no broken glass, and whether or not the patient allows you to clean the spill with a disinfectant, you want to make sure that you report the incident to your supervisor. Visit-generated waste is waste produced during the course of providing care to patients in their homes. Clinicians have a responsibility to protect the people who transport and handle medical waste. There are 3 categories of medical waste. General waste. These are waste products that are not contaminated with blood, body fluids, or excrement. They can be disposed of in the regular trash system using paper or plastic bags. They can also be recycled. Medical waste are waste products that are contaminated with blood or body fluids or excrement and do not have sharp needles or edges that could puncture a patient's skin. Some examples would be old dressings with drainage, paper towels used to wipe up a blood spill or a body fluid spill, or diapers. Municipal waste disposal systems are geared to handle items contaminated with blood and body fluids as they enter the waste disposal systems from regular, ordinary households. Sharps waste. Sharps waste includes any item contaminated with blood or body fluids that could puncture the skin of another person. Some examples would be needles, lancets, broken blood tubes. Discard sharps waste in a sharps container. Encourage the patient to dispose of sharps using community needle disposal programs, such as community drop-off collection sites, household hazardous waste centers, residential special waste pickup services, syringe exchange programs, mail-back services, home needle destruction devices. When a patient is unable or unwilling to participate in the above, obtain an empty old detergent bottle or bleach bottle, assuming that you do not have a sharps container. The bottle should be composed of impervious plastic with a screw top lid, and the patient should write biohazard on the bottle. Dispose of sharps by taping the container closed with water-resistant tape, placing it in a plastic bag, and securing it shut. This will be placed in the non-recyclable trash. We will now talk about donning PPE. The type of PPE used will vary based on the level of precautions required: standard, contact, droplet, or airborne. You should now refer to the handout provided to you about donning PPE. When putting on a gown, fully cover the torso from neck to knees, arms to the end of wrists, and wrap around the back. Fasten in the back of the neck into the top of the waist. For a mask or respirator, you should secure ties or elastic bands at the middle of the head and neck, or behind the ears. Fit the flexible band to the bridge of the nose. Fit snug to the face and below the chin. If using a respirator, it needs to be fit checked. Place your goggles or a face shield over your face and eyes and adjust to fit. When applying your gloves, extend to cover the wrists of the isolation gown. While wearing your PPE, keep your hands away from your face. Limit surfaces that are touched. Change gloves when torn or heavily contaminated. One tip would be, if you know you will need to change gloves frequently, double or triple glove and then remove one set of gloves as it becomes soiled. This prevents difficulty reapplying the gloves with sweaty hands. To remove your PPE, you want to remember that the outside of all of the PPE is contaminated. To remove gloves, you will grip the outside of the glove with the opposite hand near the wrist and peel it off. Hold the removed glove in the gloved hand. Slide the fingers of the ungloved hand under the remaining glove at the wrist. Peel the glove off over the first glove. Discard the gloves in the waste container. For goggles or a face shield, handle by the headband or the earpieces. Discard in the waste container. To remove your gown, unfasten the ties. Pull the gown away from the neck and shoulders, touching the inside of the gown only. Turn the gown inside out. Fold or roll it into a bundle and discard. And finally, your mask or respirator. Grasp the bottom, then top ties or elastics from the back and remove. Discard in the waste container. And always perform hand hygiene immediately after removing PPE. Patients have a right to live in their environment of choice. However, unsanitary conditions and infestations may place the patient in peril, of which the patient is unaware or unable to resolve without special assistance. Infestations include fleas, bedbugs, cockroaches, rodents, among other things. Upon entering the home, assess the environment to determine if the home meets the safety needs and health needs of the patient and visiting staff. If you have serious concerns about the environment, first do whatever you need to in order to secure your personal safety, including leaving the home if necessary. Then consult with your supervisor. Some possible options could include admitting the patient with an action plan to resolve the problems, referrals to APS or the health department, and social work should always be consulted to help with these actions. If, on admission or at a current patient's home, you see a bug, capture the bug if possible. This will allow for accurate identification of the bug. Keep in mind that finding one bug does not constitute an infestation. However, it does mean that further investigation is necessary. If additional evidence is found upon further investigation, bug precautions should be initiated in patient homes. Due to the sensitive nature of this topic, if an infestation of any kind is suspected in a facility, it should be immediately reported to the Chief Clinical Coordinator, or in her absence to your immediate supervisor. A thorough investigation will be done and a decision made about whether or not to implement bug precautions. Bug precautions must be entered in the safety prompt in Healthcare First and on the aid assignment sheet for all patients with an active bug infestation. Bedbug history should be entered in the safety prompt in the software and on the aid assignment sheet when a patient has a history of a bedbug infestation which has resolved or lives in an apartment complex where a known infestation exists. When a known infestation exists, don bug gear prior to entering the home, or if there is a clean, safe place to put the bug gear on immediately inside the home, it could be put on there. Wear light-colored shoes, socks, etc. that are easy to launder and dry. When at all possible, make the visit at the end of the day so that you can return to your home to shower, launder, and clean your clothes. Minimize what is transported in and out of the home. Leave your visit bag in the car. Bring in only what is needed. Carry your supplies in a hip pack or plastic bag, and document in the car prior to leaving the home. Provide a standing or low-touch visit. Do not sit on furniture. Try to stand throughout the visit. If you must sit, find a hardwood, plastic, light-colored chair and sit a bit of a distance from other furniture. Only touch the patient or things in the home with your hands. Keep a distance between the rest of your body and the patient's belongings. Upon leaving the home, remove bug gear just before or immediately after leaving the patient's home and discard in the trash. Perform hand hygiene. Perform a self-exam prior to getting into the car. A self-exam should be performed after leaving any patient's homes, not just homes with known infestation. To perform a self-exam, check your clothing and shake off cuffs and creases. Check the crevices of anything that was brought into the home. Disinfect your equipment as soon as possible. And one staff member recommended getting a lint roller and using that upon leaving homes, just to check to make sure that there are no bugs on the lint roller. If you entered a home and discovered an infestation that we were not aware of prior to the visit, you may want to reverse suit prior to entering your car. This will trap the bugs in the suit so that they do not get in your car. When you return home, remove the suit and your clothing on a light-colored linoleum floor so that you can see if any bugs fall off the clothes. Immediately launder all of your clothes in hot water and dry on the hottest setting possible. Once the clothes are completely dry, continue to dry them for an additional 30 minutes. For more information about bedbug precautions, you can look in the appropriate section in your employee handbook. And for more information about the procedures that we just discussed, they can be found in the VNAA Clinical Procedure Manual. Thank you for your attention during this in-service.